Welcome back. Joining us again is Dr. J. Raman and Rory Ritrievi. Dr. Raman, over the years, your patients have really gotten involved. They've shared their stories. They've rallied around the cause. They have donated. Yeah. So for you, what is that like to watch that come full circle?
Yeah, I mean, I would say in the month of fundraising, the majority of what I'm able to raise is just through the generosity of patients and their families. And I think it's one of the great things about our community, and honestly being a physician in the community, is that the patients are paying it forward. And I think they're donating because they know the money goes to their neighbors, their friends, their family members. And I would certainly say without their help, I wouldn't remotely come close to being able to hit some of the numbers I've been able to raise. And I think our efforts wouldn't get to where they needed to get to.
Yeah, and turning to Penn's efforts, just an incredible partner over the years. And you really get your employees involved. How are you able to really motivate them and other community partners to take part in this?
Yeah, so our employees are very community oriented. They've always been. We have a lot more of them today than we did back in the beginning. We're over 800 employees now. So they're all, we're motivating them to do it. They dress down, they contribute money, get the dress down throughout the month of November. And then they contact a lot of their customers and create these community partners. So I think we have 16 community partners this year. Some of them are repeats from previous years, but some of them are new. And so that's how our employees do it. They contribute their own money, they ask friends and family to contribute money, and they help with the community partners.
It's terrific. I love it. Again, 10 years. So I know the goal started like this 10 years ago, and it's grown to like this. So what is this milestone year goal, and how are you going to reach it?
So it's usually me with a big mouth saying what the goal is, but at our kickoff party, Dr. Raman answered the question that someone threw out, and so he said,
well, I mean, the last 2 years, we've done an amazing number, 340,000. And I said it's the 10-year, so I think we want to eclipse.
10 million.
Well, hope springs eternal, right? So I said 350,000, which would bring our 10-year total.
660-ish, yeah. Somewhere in that neighborhood.
Okay. We got to get it going then. Folks, you need to donate. And all the funds raised, that goes towards screening and education and survivorship programs. So tell me about how these dollars are really directly helping men and their families here in our community.
Yeah, I think it's a great question because it's not a matter of just raising the money. I mean, if you raise the money and you don't do anything with it, then what are you doing?
Sure.
And so I always say, I think there are 4 pillars for No Shave November. One is research and clinical trials, growing that. The second is survivorship. And I think it's not just survivorship for patients treated at Penn State. I say any prostate cancer survivor is welcome. The third is screenings, more places, more times of the year. And the last is education. So, I mean, residents, medical students, trainees, I think it's important that they be part of this because, long after I'm done practicing, the message is the same and somebody's got to carry that forward.
Right, and keep it all going forward in terms of treatment and options and the awareness. Yeah, we got to keep it going. Like you said, people need to know in order to get screened and know what's going on. So thank you.